Amlodipine lowers your blood pressure by relaxing your blood vessels. That sounds straightforward, but once you're on it, certain everyday habits and combinations can quietly work against it or increase your risk of side effects. I see this often. Someone is taking their medication regularly, but their blood pressure still fluctuates. Or they start noticing swelling, dizziness, or fatigue that wasn't there before. Most of the time, it's not the medication failing. It's something around it. A common misunderstanding is that once you're prescribed a blood pressure medication, everything else you do stays the same. In reality, amlodipine interacts with your body in ways that make certain foods, supplements, and other medications more important than people realize. When amlodipine enters your system, it blocks calcium from moving into the muscle cells of your blood vessels. That relaxation lowers pressure, but it also means your body becomes more sensitive to changes in fluid balance, circulation, and how other drugs are processed in your liver. Your liver plays a central role here. Amlodipine is broken down by an enzyme system called CYP3A4. If something speeds up that system, the medication gets cleared too quickly and becomes less effective. If something slows it down, the drug can build up and increase side effects like swelling or low blood pressure. That's where these avoid situations come in. One of the most overlooked issues is grapefruit. Grapefruit and grapefruit juice can block the enzyme that breaks down amlodipine. When that happens, more of the medication stays in your bloodstream longer than expected. You may not notice it immediately, but over time, it can lead to more pronounced side effects, especially ankle swelling, flushing, or a drop in blood pressure that feels like lightheadedness when you stand up. Alcohol is another one people don't always connect. Both alcohol and amlodipine relax blood vessels. When combined, that effect can stack. You may feel more dizzy than usual, especially in the evening. Some people notice they feel off balance or unusually tired after drinking even small amounts. It's not just about quantity, it's about how your body responds while on the medication. Then there's over-the-counter pain medications, particularly NSAIDs like ibuprofen or naproxen. These drugs can cause your body to retain sodium and fluid. That works in the opposite direction of what amlodipine is trying to do. Over time, regular use can blunt the blood pressure lowering effect. You might think your medication needs adjustment, when in reality it's being counteracted. Salt intake still matters, even though amlodipine is not a diuretic. When you consume high amounts of sodium, your body holds onto fluid. That increases the volume inside your blood vessels, which raises pressure. Amlodipine can relax the vessel walls, but it doesn't remove that extra fluid. The result is often persistent swelling in the legs or ankles, which many people attribute solely to the medication. Now let's talk about a very important medication interaction that is often missed: simvastatin. If you are taking simvastatin along with amlodipine, the dose of simvastatin should generally not exceed 20 milligrams per day. Amlodipine can increase the level of simvastatin in your body. When simvastatin levels rise too high, the risk of muscle injury increases. In more serious cases, this can lead to a condition called rhabdomyolysis, where muscle tissue breaks down and stresses the kidneys. I've seen patients develop muscle pain and weakness without realizing the connection. It's not always obvious unless someone reviews both medications together. Herbal supplements can also interfere, especially St. John's wort. This supplement speeds up the liver enzymes that break down amlodipine. That means the medication is cleared faster, and its effect becomes weaker. Your blood pressure may start creeping up again, even though you haven't changed your prescription. This is one of those quiet interactions that can go unnoticed for a long time. Another thing to pay attention to is how quickly you change positions. Amlodipine lowers pressure by relaxing vessels, but that can also make it harder for your body to adjust when you stand up suddenly. If you get up too quickly, especially from lying down, you may feel a brief drop in blood pressure. That lightheaded feeling is your body catching up. It becomes more noticeable if you're dehydrated or if the medication level is higher in your system. Speaking of dehydration, not drinking enough fluids can make the side effects of amlodipine feel worse. When your blood volume drops, the medication's effect can feel stronger than intended. You may notice fatigue, dizziness, or a general sense of low energy. It's not always the medication itself. It's the combination of the drug and low fluid levels. There's also the issue of combining amlodipine with other medications that lower blood pressure without proper monitoring. This includes certain erectile dysfunction medications, like sildenafil. Both drugs relax blood vessels. When taken together, they can cause a more significant drop in blood pressure than expected. That doesn't mean they can't be used together, but it does mean the timing and dosing matter. Swelling in the legs and ankles is one of the most common side effects of amlodipine. But what many people don't realize is that certain habits can make it worse. Sitting for long periods, high salt intake, and lack of movement all contribute to fluid pooling in the lower extremities. The medication opens up the blood vessels, but gravity still pulls fluid downward. If nothing pushes it back up, like muscle movement, it accumulates. Another point that often comes up is timing. Some people take amlodipine at night, others in the morning. The timing itself is less important than consistency. But if you combine your dose with other substances, like alcohol at night or supplements in the morning, you may unintentionally change how the medication behaves in your body. What you're really managing with amlodipine is not just blood pressure, but how your blood vessels respond throughout the day. That response is influenced by everything from what you eat, to what you take alongside it, to how your body processes medications in your liver. So the goal is not to be restrictive, it's to be aware. If you're taking amlodipine, keep your medication list simple and transparent. Make sure any new prescription, over-the-counter drug, or supplement is checked for interactions. Pay attention to how your body feels rather than assuming symptoms are random. Swelling, dizziness, or unusual fatigue are signals worth noticing. Stay consistent with your dosing. Keep your hydration steady. Be mindful of sodium intake, even if you've been told your blood pressure is controlled. And if you're on simvastatin, make sure your dose stays within the safe range when combined with amlodipine. These are small adjustments, but they make a real difference in how well the medication works and how you feel on it. When everything is aligned, your medication, your habits, and your awareness, amlodipine tends to do exactly what it's supposed to do. It lowers pressure smoothly, without drawing attention to itself, and that's usually the best outcome. And there you have it. Take this knowledge and take control of your health. Thank you for watching.